So diagnostic tests for cancers kind of vary depending on the type of cancer. But in general, we do have some fairly ubiquitous tests, or just sort of things that might lead to the thought from a clinician that, oh yeah, this might be cancer. So looking at history, physical examination. If you have a history of cancers, yeah, physical examination, maybe they palpate the mass and they feel like, yep, that doesn't feel right. Let's get it further tested. Again, though, because a lot of these are general symptoms, it's kind of hard to determine whether cancer is present or not from just this history and examination. Imaging studies do help too. You can do radiographies, endoscope, ultrasounds, CTs, MRIs, anything that can help you actually visualize the mass, and then from that determine whether that's causing some of the symptoms that may be appearing. Biopsies, cytological studies, you take a needle, you insert it into the tumor, you pull out a piece of that tissue, look at it under a microscope, looking for the anaplasia or other unique features that shouldn't be there. Tumor markers, these are chemicals, hormones, enzymes, things that are produced in response to either the the tumor itself, or the response to the tumor. So the tumor is going to be producing things too, and tissues will respond in certain ways depending on the chemical signaling back and forth, depending on the nutrients being absorbed, all of that. Different tumors are going to have different markers. There's a ton of them. Here's a list of a couple of them, but there are so many tumor markers that we already know are associated with certain types of cancers and tumors. And we have lab tests that help us to identify each of these specifically. Other things like blood, urine, other tissue tests, looking for functionality of those things. If there are weird markers present in those too, that can help us have a diagnosis as well. Again, we're being very general here because a lot of these tests are pretty broad. Some of the tests are very specific, like the tumor markers that are specific for specific types of tumors. Treatment for cancers. Again, this is going to be very specific depending on the type of cancer, but in general, here's a list of all of these things that are possible. So not all of these are going to be useful for each type of cancer, but depending on what the oncologist looks at and how they feel, you might choose a couple of these to work together, and you might not choose any of these. First thing though, surgery, trying to remove the neoplasms. That's the easiest thing to do. A lot of these strategies aim at removing the neoplasm. So surgery, chemotherapy, helping to destroy it, radiation, helping to destroy it that way, immunotherapy is helping to destroy it. So getting rid of the neoplasms wherever they are, and then stopping them from spreading, and then hopefully reducing any of the symptoms associated with it. So trying to remove the cancers themselves, the neoplasms. Surgery, you can go in if it's a clear and distinct area, you can remove as much as possible. Chemotherapies are good because they help to target cells that are fast dividing, and so if you missed some of the neoplastic cells in surgery, chemotherapy can help to catch those extras, and to catch some that might have metastasized from that site of location. Things that have metastasized, little tiny metastasis, are really hard to remove surgically, so chemotherapies would be an easier way to try and tackle those. You can kill a lot of those. Problem is, though, with chemotherapies, you're destroying healthy cells as well, so there's going to be a lot of friendly fire there. Chemotherapies make people very sick. Some people refuse chemotherapies because they just feel worse on them, and especially in terminal cancers. If you already know you're going to die, chemotherapy is just going to make it worse as you go through, making your last couple of days not really worth it. Radiation is really useful for targeted locations as well, things that maybe you won't be able to hit with a surgery. It's in the brain, surrounded by very dense blood vessels, and so going in and cutting it out would be very risky. Radiation can be used to target that because it can go through all of your tissues and help to destroy the DNA associated with that. Hormones we kind of already talked about. Depending on the type of cancers, they might respond to hormone treatments. Some of them obviously won't. Immunotherapies, there are some monoclonal antibodies that are developed against certain types of cancers. We also have some gene therapies that help us to deliver cytotoxic T cells that are specific to certain cancers that can go in and destroy certain types of cancers because they know the antigens that present with those. Certain blood diseases, you could use bone marrow transplants. You irradiate your own bone marrow that has the neoplasms in it, and then add new bone marrow to replace whatever yours was. And then just palliative care, making sure you're taking care of the person so that their total nutrition and just care in general is useful, that they're not going through a ton of pain, that they're not wasting away from lack of nutrition. Just making sure that we take care of the other needs. All right, lastly, we're going to go through some examples of the different types of cancers. We're going to stay pretty broad. We will mention a couple of the important examples in each of these, but obviously we're not going to have enough time to go through every type of lung cancer and every type of colon cancer. We're just going to hit kind of the most important ones, and we'll go from there.